Good morning, good evening, doctors, nurses, and pharmacists. I'm DrChe, and today we will discuss some important writing OET reading tips. Okay, so if you can share this session with other doctors, nurses, and pharmacists, that would be great. Okay, so yesterday we have done half of the reading part A, and most of you have enjoyed yesterday's class. Anybody has any question about yesterday's class and how was that? Can just anybody point out the main points how we can approach OET reading part A? Can you hear me? Okay, can anybody hear me? You can unmute and you can participate if you wish. Okay. Okay, so just 1 minute, we are going to start very soon. Okay. So if you can hear me, just comment below and we will continue today our reading session. So just 1 minute, please. Okay. So can you see my screen with the reading paper leptospirosis? Can anybody see? Can you?
Yes, sir.
Okay. Okay. So can anybody just resume? Just give an overall idea what we have done yesterday and what we have discussed yesterday, how to approach reading part A. Just quickly, please. Okay. No? No one wants to participate? Okay, no problem. Okay. So it's very easy. Reading part A. Just skim and scan, quickly skim and scan, reading just you know headings, subheadings, main points. Okay. And if it is table, okay, keywords. If it is a paragraph, topic, sentence. Okay. Okay. So I can't share now. I'm in the class, so I cannot you know start sharing these things. Okay. So just quickly, I will show the texts. Okay. And so there's maybe some of you are new today, so I can show the texts. Okay. Then we will start from question number 12. Okay. So this is the what is the main topic? Can anybody tell me what is the main topic today? What is the reading part A main topic? No, no one wants to participate. That is DrChe.
Sir, leptospirosis and
Okay,
its
so
type.
main topic is leptospirosis. Okay, very good. Okay, so in text A, what is included in text A? Just quickly, please, because we have already done this yesterday.
Sir, we see that it's a bacterial disease and we see its types, also main types and
Okay, mild and severe. Okay, so we don't need to go into
mild.
details of what is written in mild, what is written in severe. Just main things. Okay. Then we have one table here. This table is overall general information about lepto leptospirosis life cycle, maybe like life cycle. Okay. So what you will see in this table, in this picture, quickly, just how you can just quickly skim and scan this picture. How? So this is the environment where the leptospira lives, and it's slow moving, and it lives in stagnant water. Incubation period here. It sheds
Yes.
in the urine. Here is most of the dogs are azotemic. Okay. There is, it can affect liver also. So this is two by third cases are hyperbilirubinemia. So most cases, fatal cases, and the patient under 6 months old. And then we have dogs in urban areas are most commonly infected with this. The survival rate is this, okay, 80%, and then acute phase, okay. So just quickly, we need to skim and scan quickly, okay. Then go to the text B, that is pathophysiology. Pathophysiology is how, okay. So how the, okay, uh, this infection, how it works, okay, how it starts. This is just like life cycle, okay. So this come in contact with skin and membranes, and then infection acquired through contact with urine, and then this incubation period here, then it enters the host, and then it multiplies there. So these things are written about the life cycle, pathophysiology. Then we have history and physical. So then we have history and physical. In this here, we have two syndromes. One is, Dr. Zartash, can you help us?
History and physical tell us that leptospirosis is presented as two distinct clinical syndromes,
Very
icteric
good.
and anicteric.
It's okay.
And
So
then
in
here is
first two
detail.
paragraphs are about in anicteric, because you can see here, these are the word anicteric. And the third paragraph is about icteric phase of leptospirosis.
Right, sir.
Okay. Okay, very good. Okay. So then we have the last text D, that is about prevention and
Treatment and
treatment. Okay.
prevention.
So in this part, they're talking about treatment. In this part, almost is about treatment. And here is the prevention. Just quickly skim and scan, please. Treatment and prevention. Okay, so here in the first part, they're talking about the treatment, and in this part, they're talking about the prevention. Okay, so this is our quick skimming and scanning. Then yesterday we have done almost, okay. So I think 11 questions or 12 questions, Dr. Zartash, if you remember.
Questions, 11 questions.
11 question, okay. So question number 12, Dr. Sanagul, can you hear me? Spencer Blue, okay. Okay, so you will help us in the question number 12, okay? A type of leptospirosis which can appear in two phases. So just tell us, and those who are on Facebook or Zoom with me, just write in the chat in which text it is possible to find answer to this question. Quickly, please. Yes, please. ARC. So Dr. Sana, where you would like to go? In which text? Dr. Sana, can you hear me? Okay, Dr. Zartash, in which text you will go?
Sir, C.
You will go for text C?
Yes, sir.
Sorry. So here is your text C. Okay. And here is your question.
Pathophysiology.
Okay. So just once you get the answer, just tell me got it. Okay. Those who are with us on Facebook or on Zoom, just write your answers in chat. Okay. Write your answers in chat. Nobody will answer quick directly. Just write in the chat what is your answer. Please write your answers in the chat. Please write your answers in the chat. So please, all of you, once I send a text that, okay, so send me a text to get the Zoom link. So please try to send me a text to get the Zoom link so that you can participate directly with me. But overall, it is okay also in the on Facebook. Okay. So Dr. Suman, can you hear me?
Yes, sir.
So what is your answer?
Icteric or anicteric.
So your answer is both icteric and anicteric. Very good. And Dr. Zartash, what is your answer?
Sir, same in first line, icteric and anicteric.
Uh, so your answer is icteric and anicteric, both of them.
Yes, sir.
Okay, okay. And okay, Dr. Abdullah. You can people unmute and can participate. Okay. Okay, DrChe has just joined. And Miss or Dr. Priyanka. Okay, Dr. Sumar, why your answer is both icteric and anicteric? Why?
So here is can appear in two phases. Two. That's why
Uh-huh.
there is two phases, sir. And that may be icteric or anicteric.
No, that is wrong answer. Most of you have given wrong answer. Icteric or in anicteric. I'm not asking classification of leptospirosis. I'm asking a specific type of leptospirosis that can appear in two phases. Leptospirosis itself can appear as icteric and anicteric. But now I'm asking a specific type of leptospirosis that can appear in two phases. Overall leptospirosis can appear in icteric and anicteric, that is okay. But here I am asking about a type of leptospirosis, not leptospirosis itself. Now, just a type of leptospirosis that can appear in two phases. So most of you have given wrong answer. Most of you have given wrong answer. Most of you have given wrong answer, okay? So what is the answer, correct answer? And B, no, answer is here in front of you. Answer is here in front of you. Yes, I can give phone number, don't worry. Somebody is, Facebook is not working, WhatsApp, could I have link? Okay. We can discuss these things later on. Okay. If something is not working, please don't worry, okay. So, Dr. Suman, moderate or severe, no? So let us go there. Some people are saying that, let us go to mild or severe, okay. Symptoms include muscle pain, possible headache, organ failure. They're not talking about, phases and, types and these things. So answer is here. So anybody on Zoom can tell me what is the answer? Dr. Nirmala, Miss Nirmala, can you hear me?
Yeah, doctor.
Yeah. Yeah, what is the answer? What should be the answer, Dr. Miss Nirmala, Dr. Nirmala? Dr. DrChe. Dr. Simon Javed is giving good answer on Facebook. Very good. Excellent. Dr. Simon Javed. Okay, Dr. DrChe, let us try, okay? I will help you. Can you hear me?
Yes, sir. Anicteric syndrome,
Ah,
as this phase
why?
is called the stage.
Why? Why? Why, doctor? Well, if you read here, anicteric syndrome can also have recurrence several days later. And this phase is called immune
Immune
stage, during which aseptic meningitis can occur. These patients can recover fully, but may suffer from chronic episodic
episode.
headaches. So we have two types of leptospirosis. They are written here. Leptospirosis can present in two distinct clinical syndromes, icteric and anicteric. So out of these, which type can appear in two phases? Icteric cannot appear in two phases. They are not written. So this is the anicteric that can recur later on, can appear in two phases. Okay. This phase, okay, is this one,
Called
okay.
immune
So
stage.
which type
Yes.
of leptospirosis can appear in two phases? So what is the answer?
Anicteric.
Anicteric only, or you can say anicteric syndrome,
Syndrome.
or only anicteric, okay. So this is the answer.
Okay.
Please be careful, people. This looks very small when you are under time pressure in the real exam, and then you will spend a lot of time and you will make mistakes, and then if you don't get good score in reading part A, then it becomes difficult to pass, okay, the reading exam. Okay, so here we have leptospirosis is less likely to be contracted if dogs are in less contact with, okay. So in which text is possible to find the answer? Please write in the chat in which text is possible to find the answer, please. In which text it is possible to find the answer to this question, question number 13. In which text? Okay, in which text it is possible? Okay, Dr. Zartash, in which text is possible? In which text is possible, please? So most of you are saying text A, okay? Let us go to text A. Can you find in the text part of the text A? Here? No. I think no, okay? The answer is not here.
No, Mary, no.
Try to find in the table. Try to find in the table. Please participate actively. Participate actively. Can you find the answer in table? Quickly, please. So the question is, the dogs are less likely to contract leptospirosis is if they are in less contact with something, okay? Can you find the answer here? Can you find the answer here, please? Quickly, please. Can you find the answer here in this table in text A? Dr. Cheryl,
Sir.
can you hear me?
Yes, sir.
Can you find the answer here?
Is it the next to the second bullet point down below, right? Dogs in urban area are mostly commonly infected through contact with infected rodent urine. Less contact with
Okay,
infected urine.
so read the question.
Leptospirosis is likely to be contracted. Dogs are less. Okay, maybe not.
Your keywords are matching here or not?
No, sir.
Your keywords are not matching here. Even if this could be the answer, but your keywords are not matching here.
Hmm. Yes, sir.
So what we should do? Where we should go?
Probably maybe in the last text.
In prevention?
I'm not so sure, sir.
Okay, let us go there. Might be possible when we are in the prevention. So maybe, so nobody will tell me the answer. Just write in the chat if you find the answer. Just write got it, okay? So this is the last paragraph, the last text. Prevention and treatment. Please try to find the answer. And don't tell me, just write in the chat, okay? People on Facebook, please, you should also give the answer. No, the question is not, this is not the question. Question is, leptospirosis is less likely to be contracted if dogs are in less contact with them.
Sir, can I tell you my answer?
Yes, please. What is your answer?
The second paragraph, reducing your dog's exposure to possible sources of leptospira
Uh-huh.
bacteria can reduce his chances of infection.
Uh-huh. When treated early, recovery is good in this. Okay. Currently available vaccines. Okay. SEMOS, available vaccine available. So your dog exposure to possible sources of the leptospira bacteria can reduce its chance of infection. So leptospirosis is less likely to be contracted if dogs are in less contact with
Sources of,
possible sources. Okay. Yeah.
yeah.
So reducing your dog's exposure to possible sources of the leptospirobacteria can reduce its chances of infection. Okay. So leptospirosis is less likely to be contracted. So what does this mean? Chances of infection. Okay.
Mhm. Okay.
So if dogs are in less contact with possible sources. Even I was not thinking this was the modern this was the sample that I have written long time ago. Even I was thinking here this point. Okay, believe me, I was thinking this point.
Hmm.
I was thinking this point, third bullet point.
Okay, sir. What is the correct answer, sir?
So answer is possible sources. That is the correct one because all of your keywords are matching there.
Ah, yes, sir.
So here you are not sure this avoid skin contact. Maybe this skin contact is skin is ours and urine is of dogs. So this is
Mhm.
not the answer here. So most of you can go here in third bullet point. I also was thinking about this. Okay, as I didn't read this here. So if you don't go above and don't read there, then most probably you will write the answer urine. Okay.
Hmm.
So this is how the examiners make us fool, okay? The real exam. The answers are not difficult. You need to match your keywords and you need to quickly skim and scan, okay? You need to quickly skim and scan the important things, okay?
Yes, sir.
So water, somebody has told me the answer water is not the answer here. It is not written here. So please, if you see here, all of your keywords are matching here in this sentence, okay? Reducing your dog's exposure to possible sources. This is the second part here. Okay, reducing less contact with possible sources can reduce chances of infection. So leptospirosis it's itself an infection, okay, is less likely to be contracted. So you have less chances of getting infection if your dogs are in less contact with possible sources, okay? So your keywords are matching here. Even I was thinking here, this third bullet point, okay? So very good. So who has given this answer? Who has given this answer?
So me?
Dr. Shirel, okay.
Sorry.
I'm
Yes,
sorry,
sir.
I cannot give you free writing correction because you are already in our VIP Habit course. So you are getting unlimited corrections. If it was
Yes, sir.
somebody else, I should have given one free correction, okay? So
Okay.
Dr. Shirel, you can just tell us, you have joined VIP Habit course and almost less than 1 month ago, 20 days
Yes.
ago almost. So how
Yes.
many letters you have you got corrected so far? Almost.
Uh, at least 20 or
I
maybe
think
close to 20. Maybe close to
no.
20. I'm not.
14 letters of old file and you are almost to finish the new file also.
Yeah,
So new
correct.
file has 27 letters. The old file has 14 letters.
Yes, sir.
So I think it would be above 30.
Yes, sir. Probably, yes.
Yeah, because no, you are writing one letter because you don't have more case notes. So are you happy with the course?
Yes, sir. I'm very happy.
Yeah,
Yeah.
okay.
Thank you
So
so much.
most of your letters are B grade nowadays, and even at the start your writing was good. Okay. So
Okay.
did I charge you extra if you send me more than 14 letters for correction?
No, sir.
That is part of
Uh,
VIP hybrid course.
yeah.
That is why it's called PVP hybrid. Okay. Okay. So the next question will be answered by Dr. Zartash. Okay. So this is the question. For how much time the kidneys of an acutely infected dog with leptospirosis might not perform well? In which text we can find the answer, Dr. Zartash? Other people write in the chat, please. I cannot see comments on Facebook. Please write in the chat, okay? On Facebook, please write in the chat in which text you can find the answer, please. Okay, Dr. Zartash, where you can find the answer in which text? You cannot give answer on your own knowledge, okay? You need to find the text, okay? Dr. Zartash, where is possible, please, just quickly. No? You don't have any idea? Okay, Dr. Nirmala, can you hear me? Dr. or Miss Nirmala, can you hear me?
Yeah, doctor.
Okay, so in which text is possible? In B?
I think.
Yeah, no problem. We can go to B. If you don't find the answer here, we can go to other text, okay? Don't worry. So try to find the answer here. If you can't find here, we can go to other text, okay? Just quickly skim and scan, okay? Don't spend too much time. What are your keywords? What you're looking for?
1 to 2 weeks.
So your is timing, sometime, mention of kidneys, and something that is acutely infected dog, okay? So try to find the answer here, please.
Sir, 1 to
Okay. Can you find the answer here in text B? Dr. Zartash, where is the answer? Dr. Zartash? Your answer is 12 months. Where is the answer? In which paragraph? Okay, Dr. Nirmala, where we should go now? You cannot find the answer here.
Not given.
Okay, not given, but we can find another text where we should go. In which text?
I think A.
A. Let's go to A. One month is wrong answer. Miss or Dr. Rafika. 1 month is wrong answer.
sir, I found.
Okay,
More than 1 year.
50%.
so where are your keywords are matching here?
Impaired renal function.
What is the answer?
More than 1 year, sir.
So the
Yes.
answer should be more than 1 year, not only 1 year.
More
More
than
than
1
1 year. So you cannot find the word dogs here in this text. So how you can say this is they're talking about dogs? This I was wondering. 16 days is wrong. You can find this is maybe they are including the humans also, the cats also, dogs, all of the animals. So how you can say how much time the kidneys of an acutely infected dog with leptospirosis might not perform well? So how you can say they're talking about dogs? Anybody can answer this question? Can anybody answer this question? No?
The dogs
Dr. Shireen?
are in,
Yes, please.
I
doctor.
think they mentioned up to 50% of dogs.
Yes, it is mentioned here, above this circle, okay? Up to 50% of dogs. So they have written 50% here in here, okay? So now they're talking about the dogs, okay? Up to 50% dogs that survive the acute phase of leptospirosis. So the complete sentence is like this, okay? Survival rate at 80%. So out of this, up to 50% dogs who survive, those who survive up to 50% that survive the acute phase of leptospirosis have impaired renal function for more than 1 year. Survival rate is 80%. So up to 50% of dogs who survive this phase, they have impaired renal function for more than 1 year. Okay. So you need to attempt reading exam with opened eyes and open mind. Okay. Please. Okay. So now question number 15 to 20. What should we want to avoid contact with urine of pet, of a pet, pets? So in which text we can find the answer to this question, okay? In which text?
D.
Why in D? Because they're talking about the prevention there, okay? So what should be the answer? Write in the chat, please. Don't tell me. Please, people on Facebook, write your answers in the chat, please, quickly. Write your answers in the chat, people on Facebook, please. What should we want to avoid contact with urine of pet, okay? Write in the chat, please. Very good, excellent, okay? Excellent. So don't think that in the real exam, they will give you each and every question tricky. There would be some questions, very easy questions also. So the answer is gloves, okay? Next question is, which phase of leptospirosis is commonly called as Wills disease? In which text you can find this answer? In which text? See, in which text you can find this answer?
In A.
So some of you are saying A, some of you are saying C. So first I will go to C. So here is your question. So what is your answer? Ecteric phase. Let us go to A also. Can you find the word Wills disease here? No, not here, okay? And these two types, no. They've written only in ecteric phase, okay? So the answer is ecteric phase. Very good, excellent.
But they
So
mentioned the first line in text A.
Yeah, in text A, but it's not talking about in which type. Okay, leptospirosis is rare bacterial disease, also called as Wales disease. Okay, they're not talking about which phase of leptospirosis is called Wales disease. So here they're talking about this is the ecteric phase that is commonly classically known as Wales disease. Okay. So the answer is ecteric phase. Next question. In younger children, the majority of patients are found to have dash leptospirosis. In which text you can find the answer to this question, please, quickly. In which text you can find the answer to this question? Quickly, please. In which text? People on Facebook, in which text you can find the answer to this question? No? Text A. So most of you are saying text A. So let us go to text A. First try to find in this text and then I will show the table. Can you find the answer in text? Be in the text part of the text A?
No.
No, okay. So then go to table, okay.
No, sir. No.
So the answer question is in younger children, majority of patients are found to have dash leptospirosis. Okay, can I find here?
No, sir.
So where we should go? If you
C,
cannot
sir.
find the answer here, or someone is saying we should go for C. Okay, C. Yes. So here is your question at the end. What are your keywords you're looking for? Younger children, okay?
Younger children.
Majority of patients. All the questions would not be easy. Some questions will be tricky, and some questions you need to spend some little bit time. Okay. Can you find the answer in text C?
No, no, sir.
No, not here. So where we should go now?
B.
D? Okay. So here is your text. Here is your question.
I think B, bravo.
Bravo. Okay.
No.
Let us find in D. Okay. Can you find in D or not?
No, sir.
I think it's not here. Let us go to B as in Bravo. Okay. Here is text B. Here is your question. Can you find the answer here? Can you find the answer in text B, please? Quickly. Quickly. People on Facebook, please try to comment something so that I can see that you are also active. People on Facebook, please try to participate actively. Write something in the chat, okay? So you cannot find the answer here in text B also. So then where we should
I
go?
think in text A, in paragraph, there said fatal leptospirosis, fatal leptospirosis, because the younger children is like more than 6 months old, something like that. I'm not sure.
Okay. So people, we cannot find the answer in B, C, D, and A. Try to find again here. Try to find again here.
It's fatal, fatal.
Please try to find and write in the chat, okay? If you can find, write in the chat. Dr. Siman Javed on Facebook. Can you find the answer, please?
Yes,
More
sir.
than
Most
two
cases of
hard cases.
fatal
What?
leptospirosis are
What is the answer? What is the answer?
fatal.
Fatal, okay. People can see the answer is fatal. Fatal leptospirosis. So first at the start, I have shown you text A, but none of you could get the answer from text A. Then you have searched in text B and C and D. You could not find the answer. So what I am doing, okay, is the same. This is the just paraphrasing of this sentence, okay. Most cases of leptospirosis, fatal leptospirosis, are in patients under 6 months old. Okay. Most cases of fatal leptospirosis are in patients under 6 months old. So in younger children, what does younger children mean?
Under 6 months
Under 6
old.
So
months old.
those who are very young, okay, younger children. So this is the synonym of those who are under 6 months, because I cannot write directly here those who are under 6 months. If I write it here, everybody will find the answer, okay? Yes. Sadhana Sharma, are you a doctor or a nurse? Are you a doctor or a nurse? You are the first who gave answer. You are the first one. Are you a doctor or a nurse? Okay, one free correction for you. You can contact me, okay? You can contact me after class, and one free writing correction for you, because you were the first one who gave the correct answer, okay? So majority of patients, what is the synonym I'm using? Majority of patients?
Most cases.
Most cases, okay, are found to have, are the cases of something, okay, dash type of leptospirosis. Okay, so this is fatal leptospirosis. What I'm doing is I'm just paraphrasing this sentence into in a different way. Okay, so then it becomes difficult for you to answer. If I give directly like this, and children under 6 months old, the most cases of leptospirosis are, so it's very easy to answer like this. So that is why the writer will always twist the question a little bit, okay, by doing paraphrasing, using synonyms, so all of these things. Okay, be careful, please. Okay, so now we have 3 questions left, question 18, 19, 20. Before we do these 3 questions, just one thing that I need to show all of you. Just 1 minute, please. Then we will go for these 3 questions. So for writing, we have VIP hybrid course. This course is very useful, and most of the students, almost more than 90-95%, once they join this course, they get their required score, because this is very, the problem is here, all the letters are corrected by myself, okay? Only by me, no one else. I don't have any other teacher, okay? All the letters are corrected by myself. And I also provide model answers for each letter, okay? So all the model answers are written by myself. So in the course, you have 14 letters, 3 referral letters, 3 urgent referral, 3 discharge letter, 2 letters to non-medical professional, 1 letter to pediatric patient, and 1 letter in which there are 2 patients in 1 letter, and 1 letter is GP to GP transfer. In case of nurses, is 1 community nurse to other community nurse letter, okay? So most of the cases, once you finish these 14 letters, I continue helping my students with extra letters, with extra corrections, without extra charges. And people here can give, their comments, because some of you are already in the course, okay? So once you finish these 14 letters, I will send you another file. You can send more letters. I keep helping my students till their exam. The course fee is 100 British pound. After 30% discount, you can pay only 70 British pound. And once you join this course, forget about writing, because you will get enough preparation, enough feedback, enough, help to get your required scores. Speaking feedback is also available. One-to-one feedback classes, okay? Okay, so question number 18, a condition using the immunological reaction phase of a condition caused during the immunological reaction phase of leptospirosis. In which text we can find the answer to this question? Quickly, please, quickly. We already seen somewhere. Yes, in C, okay? Ecteric phase. So what is the answer? No, in anecteric, not in ecteric.
Aseptic meningitis.
What is the answer? No, this is where you can find the answer. Condition caused during the immunological reaction phase of leptospirosis. What is the answer? Answer is not anecteric. It is wrong answer. Write in the chat, please. Don't tell me the answer. What is the answer? Very good. The answer is aseptic meningitis. Okay. This is a medical condition. It can occur. Okay. So a condition caused, okay, during written directly here, during the immunological reaction phase of leptospirosis. So the answer is aseptic meningitis, not anecteric syndrome. No. The answer is aseptic meningitis. Be careful, please. A small mistake can give you wrong answer. Okay. So here, if leptospirosis crosses the placenta of a pregnant in the last trimester, can result in death of unborn infant, but dash can be caused before this period. Okay. So in which text you can find the answer, please, quickly. In which text you can find the answer? Quickly, please, quickly. In which text you can find the answer? Text B, very good. Okay, let us go there. Very good. So here is your question. Here is your text. Please try to find the answer and write in the chat. What is your answer? Write in the chat, please. So what is the answer? Write in the chat, please. People on Facebook, guys on Facebook, please write your answers in the chat, okay? Write your answers in the chat, okay? What is your answer? People on Facebook. What is your answer? So Muzambil Sultana says stillbirth, very good, excellent. Stillbirth, okay. So Rafiq, doctor or nurse Rafiq says that stillbirth, very good, excellent. But why people on Zoom are giving wrong answer? Dr. Simon Javed, I am waiting for your answer. Are you there, Dr. Simon Javed?
Yes, sir.
No, one Simon Javed is there also on Zoom, on Facebook. If you are same person, then is okay. No, you're Dr.
Yeah.
Suman, okay. So Dr. Simon Javed is on Facebook with us. So what is your answer, Dr. Simon Javed, please quickly. So Dr. Zatash, can you tell us what is the trick that the examiner is using here? Examiner I am, okay, DrChe. Because these samples are written by myself, okay. So what is the trick? Dr. Zartash. So Dr. Simon Javed, what is your answer? Yes, Dr. Zartash? What is the trick?
Infection. The
So the
word
answer is,
infection
so
can
what
be
is
caused.
first, what is your answer?
Infection.
Okay, your answer is infection. Very good. So where you can find this answer?
Sir, if an infected human is pregnant leading to a miscarriage in the first 2 trimesters, if infected, if infected during the 3rd trimester, pregnancy can result in stillbirth.
So what is your answer?
Stillbirth or intrauterine death.
Very good, excellent, excellent. So your answer is stillbirth or intrauterine death. So Miss Priyanka, can you hear me? Dr. Priyanka or Miss Priyanka? Can you hear me? You can unmute. So Dr. Suman, what is your answer?
Miscarriage, sir.
Why? They are saying stillbirth, but you are saying miscarriage. Why?
Sir, here it said birth dash can be caused before this period. Before this period means last trimester, sir.
Yeah.
Before last trimester.
This is the twist, okay? Just I'm twisting the information. If I ask question like this, if leptospirosis crosses the placenta of a pregnant woman, okay, let me show you. If I ask question like this, okay. So what is the answer to first question? If leptospiro crosses the placenta of pregnant woman in the first trimester, can result in, what is the answer? What is the answer here?
Miscarriage.
Miscarriage is very
Miscarriage.
easy, okay? If it transmitted across the placenta and infected a human is pregnant, leading to a miscarriage in the first 2 trimesters. So first trimester is first and second, okay? Both of them can result in miscarriage, okay? Miscarriage. So here I am just twisting the same information, just I am checking in other way, okay? If leptospira crosses the placenta of pregnant woman in the last trimester, it can result in death of unborn infant. So what does this mean, death of unborn infant? What synonym is there in the text?
Still,
Stillbirth or intrauterine death, okay? These are the synonyms of death of unborn infant. So this is the synonyms, okay? But now I am asking opposite thing. But dash can be caused before this period, means before third trimester. What can happen? So the answer is miscarriage, okay? So this is the issue that people, you need to learn how they make the question. Never ever the examiner will ask you the question like this, because everybody can answer the question like this. If leptos crosses the placenta in the first trimester, it can result in, everybody will answer miscarriage. But if I make question like this, some of you will write stillbirth, some of you write intrauterine death, some of you will write miscarriage, some of you will write infection, okay? So this is how the examiner make things tricky for you, okay? So please, when you do reading questions, keep in mind these things, okay? Last question, the majority of dogs infected with leptospirosis are, okay? So where is the answer to this question? Where is the answer to this question? In which text? In text A in the diagram, okay? So please try to find the answer quickly, because now it is time for me to go for my writing class, paid class. So write the answer in the chat, please, quickly. Write the answer in chat, okay? If any of you wants to join VIP hybrid course for writing or individual feedback for speaking, you can contact me on my WhatsApp, okay? So what is the answer to this question, the last one, okay? The majority of dogs infected with leptospirosis are. What is the answer to this question? Just write in the chat, please. It's very good. So the answer is here. Most mean 85, 87 to 100% mean most of the dogs with leptospirosis are azotemic, okay? Majority of dogs infected with leptospirosis are azotemic, okay? So your answer is here, azotemic, okay? Anybody has any question, anything you want to ask me? Maybe tomorrow I will arrange a writing class. So I will send the case notes. So you can text me on WhatsApp to get the case notes. So then I will,
Sir,
yeah, you can
one
write
question
letter, you can send me. Yes, please.
Sir, I want to ask you, you will take the classes for reading or listening also, or only writing and speaking?
Writing is speaking, because reading takes too much time, and as you know, I'm a doctor like most of you. I'm on duty doctor, so it becomes very difficult for me to manage, because very long classes, 1 month, 2 months, and daily classes, so it becomes very tiring. Okay, I have taken
Because
2-3 courses.
I'm
I have
facing
taken
trouble
two.
in the writing and reading and listening, because writing and speaking I'm fast, but this both I fail.
Yes,
This
yeah,
reason I want to ask you.
yes. Many people find it difficult to pass the reading, but a little bit difficult for me to organize the classes due to time issues and my job and all of these things. But still, if there is any possibility, I will let you know in my WhatsApp groups, but it's less likely, okay? So somebody asked me the question. So here was the answer was miscarriage, okay? But miscarriage can be caused before this period, okay? In the first answer. So thank you so much, all of you. If anybody needs help in writing or speaking, you can contact me. And keep in touch with me for free classes. Sometimes arrange reading class, sometimes writings. Tomorrow, most probably, I will arrange a writing class. I will send my own case notes. These would be new case notes. So you can write letter, you can send me for feedback, and we will arrange writing class tomorrow at the same time, most probably. But to get the case notes, you have to send me a text, okay, on my WhatsApp. Thank you so much, all of you. Thank you so much.